Kia ora, I'm Rebecca Macbeth, Media Editor at HINS, and here at Digital Health Week, HINS gave attendees the opportunity to have their say on how technology and digital enables frontline clinical care and the impact of data and digital budget cuts on frontline clinicians and on patient and whānau care.
Digital tools enable us to have a measurement of what is going on in real time. Being able to understand what is the experience of our frontline workers, such things around productivity, burnout levels, then we can start to make changes and then measure if they are working. Using digital tools to do this will enable our economy to be more efficient and to increase productivity by reducing burnout.
So my name is John, I'm a GP and product owner at Te Whatu. I think the thing that brings to mind is that technology can really help us connect with our patients. So technology done really well can look like magic, where we actually are able to get everything out of the way and connect with people on a human-to-human level. I think that is the real art to great clinical care. And so that's what the ambition and possibility lies in the current technologies that we have. And it's just a matter of us, I think, collaborating a bit better, thinking a bit more about what's possible, and then going out there and implementing some of these amazing tools that already exist today.
It enables us to work in a smarter way. It allows us to share information. It can create processes that allow for better audit and quality improvement without increasing the amount of work we have to do. I think also potentially it gives the patient control over their data and their medical record, which gives them more choice. And going forward, if we actually manage to organise our data and interrogate it properly and capture the patient voice, it would allow us to provide services that actually meet the patient need rather than what we think they need to do.
So nurses are very much a large part of the clinical workforce in hospitals and outside of hospitals. What nurses really need is end-to-end integrated information technologies that digitize information that they need to be able to provide care. If they don't have electronic systems that are interoperable, or if some of those systems are removed due to budget cuts, then the nurses are unable to practice at the top of their scope and be able to deliver good health outcomes in a high impact way. What happens then is that nurses are enabling errors to creep in. They're enabling more work to have to be done to achieve better health outcomes, and they also are risking patients' lives.
Well, for patient care, firstly around the opportunity for health promotion through digital channels so that we can increase awareness, understanding, so that patients can have better self-management and ultimately prevention. Secondly is about increasing access to healthcare through telehealth and online care, particularly for Māori, for Pacific, for rural communities and for those with disabilities. Importantly around for our health workforce and providing more flexibility about how they work, which could be online or in clinic. And lastly, for the health system in terms of being able to provide, I believe, more effective and efficient care through utilising digital technologies as well.
I'm a pharmacist, and in the work that I'm doing with our application Rōrō digital technology is enabling chemotherapy treatment to be delivered to patients in the northern region safely and efficiently. It's also allowing us to capture data for these patients to share back to Canshare and Te Aho Te Kahu to give us insights in terms of equity and where treatment is happening.
So as an emergency medicine doc, I've always been a huge advocate for digital tools and technologies. For me, it's all about making the clinician's life easier at the end of the day. Technology hasn't always done that, but I think as we move more into user-centered design, it certainly is starting to achieve some wins for clinicians, both from an efficiency perspective, but also very importantly from a safety perspective. And ultimately, all of this stuff has to make a difference for our patients. So for me, it's about increasing access, ensuring that we're addressing barriers to actually achieving equitable outcomes for the populations that we serve, and ultimately getting our patients a better experience and a better outcome. So, those are lofty goals and aspirations, but I think we're starting to see technology really actually get us to that point now.
Yeah, the budget cuts couldn't come at a worse time. We are still got the effects of COVID, where we have been working at the top of our productivity for so long. As healthcare workers and as a doctor, we're exhausted. We need to know that things are going to get better. by having a measurement tool to be able to see if things are improving when we're doing these new efficiencies, then that's going to be really vital. So more investment is needed into our staff's wellbeing and into data and digital tools to measure what's going on.
As a speech and language therapist by background and now working in the clinical informatics community and looking out for allied health, it's going to have a significant impact on the changes that we've already started to make, where we're trying to enable new models of care. We are, enabling things. We're on the cusp of getting there. And the thing I have concerns about is that will be halted, stopped. We are trying to work towards consumer-centric, whānau-centric care. And if we don't have the digital to support that, then how do we enable that? How do we move into the 21st century?
So as a nurse, even at this point, we've been woefully underserved by technology. We're still very paper-based. We collect some of the best information about a person's function, how they're managing their illness, how their families are managing. And without investment in clinical informatic tools, we will not be able to progress to utilize that data. I think we also lose the opportunity to build capacity in the system because we have to pre-invest, build the technology so that we can move care out of the big buildings into the communities that the people live in and provide the support through virtual and other modalities. And I think not doing that will set us back in the future managing our population health.
In terms of our work, the impacts are being felt around recruiting resources for business as usual roles to support the application that we've been working on for chemotherapy. Also, the teams that deliver the training for the application also affected. And I think the cuts will also cause loss of knowledge and grey matter. There's deep knowledge in the system that could potentially drive things forward that might be lost. And the other thing really is I think it'll just put the brakes on the pace of innovation and rolling out of these kind of things. We'll get there eventually, but I think it will take longer.
It's a very difficult time for the entire sector at the moment. I think that delineation between front office, back office is, actually quite unhelpful because I'm a proponent about team-based care. And ultimately, everybody that works in health, in my view, is a caregiver. So I know it is going to be a pretty painful few weeks and months. One thing I guess I know about colleagues in the sector is that we find a way through. That's what we do in health. So whilst it's a pretty tough and challenging time, my optimistic side and my hopeful side is telling me that actually we will use this as an opportunity to innovate even more and to ultimately make the lives of our patients and our clinicians even better once we get through this pretty rough and dark patch.